Hi everybody, Dr. Daniel. And today I'm talking about a new drug that's out called Trudeasia for acute migraine treatment. And this is really an old drug with a new delivery system. Approximately 31 million American adults have migraine, a syndrome that comes in attacks with moderate to severe head pain. Migraine is associated with nausea, vomiting, and sensitivity to light and sound, and is the second most common cause of disability in the world. Migraine is the most common cause of disability among women. Trudeasia is a new drug mechanism utilizing dihydroergotamine called DHE for acute treatment of migraine. And ergotamine has a long historical use in medicine. But there's a need for an improved delivery system of DHE, such as available. Now it comes with Migraine, which would be a competitor drug that's been out a long time and it's generic. And patients tell me that it tastes bad and runs down the back of my throat with use. So in October 2021, the FDA approved Trudeasia for acute treatment of migraine with and without aura. Trudeasia delivers DHE to the upper nasal cavity, which has an increased arterial blood supply and provides more consistent and higher drug absorption. Trudeasia utilizes POD, which is abbreviation for precision olfactory delivery, which is designed to gently deliver medication to the ideal place, the nose, for rapid absorption. And DHE is a proven drug that's been used by specialists for years. So what is the history of ergotamine? Although first used in the 16th century during child delivery and obstetrics, it was not used for treatment of migraine until the 19th century. The British ENT surgeon Edward Wokes, who lived 1837 to 1912, first recommended ergot as a vasoconstricting agent for migraine and other neurogenic conditions associated with vasodilatation in 1868. Wokes subscribed to the theory of vasodilatation by sympathetic deficit, presented in the early 1850s by Brown Secord and Claude Bernard. DHE was introduced as an adrenalinic agent in 1943. What's the use of DHE in neurology? DHE has been used in migraine since 1925 and is currently available parenterally as IV and IM and as a nasal spray. It's not absorbed well orally. DHE has a special place in treating the most common new patient diagnosis to headache practice, which is medication overuse headache, 89% of new patients. Migraine, the other DHE nasal spray, is said by patients to have the problems as mentioned above, of tasting bad and running down the back of their throat. These problems are addressed by the administration of Trudeasia to the upper nasal cavity. And this upper nasal space has arterial vasculature that's more permeable compared to the lower nasal cavity, which is less accommodating to deliver drug absorption. And these advantages allow for better consistency in dosing and absorption of drugs, as well as the potential for improved efficacy and faster time to onset of action, meaning patients may stand to achieve fast and lasting symptomatic relief. Also, Trudeasia bypasses the GI tract and potential absorption issues, since 80% of patients who develop migraine have gastroparesis during their attack. Well, I have a picture of Trudeasia on my webpage at www.drmigraine.com. You may go there if you want to look at it. But how is Tridesia dosed? It comes in this nasal spray, which is a 0.725 milligram given per actuation. That means per spray. For acute treatment of migraine, one spray should be delivered to each nostril once, so that's 2 sprays, right and left. The patient may repeat the dose once after 2 hours. One after 1 hour. The patient should discard Trudeasia within 8 hours after that. And the maximum dose is 4 sprays per day or 6 sprays per week. Considering patients with renal impairment, there's no limitation of Trudeasia dosing from mild to moderate renal impairment, but dosing is contraindicated for persons with severe renal impairment or severe hepatic impairment. There currently is approved use of Trudeasia for pediatric age patients. And it's a self-administered deal by the patient. It has some preliminary assembly if necessary, but after you assemble it, the drug should be released and primed before using by squirting out 4 nasal sprays. Once assembled, you got to prime it, and then you can use it immediately after priming. And the recommended dose of Trudeasia is 7.45 milligrams. 0.745 milligrams. It's administered as 2 metered sprays in the nose, 1 spray into each nostril. And the patient should not use more than 2 doses of Trudeasia within a 24-hour period or 3 doses within a 7-day period. A patient should then discard Trudeasia within 8 hours since the vial has been opened or the product has been assembled. And there's also a consumer assembly video available at www.trudeasia.com. What are the contraindications of Trudeasia? Well, it's mainly hypertension, coronary artery disease, peripheral arterial disease, migraine with brainstem aura, hemiplegic migraine, or stuff like that. I have a long list on my blog site. What are their adverse reactions? Well, the main thing there is nausea, taste changes, dizziness, occasional vomiting. There are a much longer list of that listed on my blog. When they did a controlled study for this, they found no serious Trudeasia-related treatment emergent adverse effects. And they had a study called the STOP, the STOP 301 study. And the majority of side effects there were mild and transient in nature. In that study, there were nasal congestion present in 17%, nausea in 6%, nasal discomfort in 6%, abnormal olfactory test in 6%, and vomiting in 2%. So, what are the drug reactions with Trudeasia? You can have it react if this is an ergot alkaloid, which could counter-interact with patients and drugs containing this CYP3A4 substrate, or the 5H2B receptor. Are there safety or monitoring issues? Well, patients with coronary artery disease should have an ECG electrocardiogram after the first dose. What is pregnancy and lactation advised for Trudeasia? They're both contraindicated with Trudeasia use at this current time. What are the pharmacology issues with Trudeasia? Well, it's metabolized exclusively in the liver, and it's excreted in the bile and feces, while 2 to 7% are excreted in the urine. The half-life of DHE is 10 to 12 hours. DHE activates vascular serotonin 5-HT1D receptors, which constricts cranial and peripheral blood vessels, and it is not a controlled drug. Remember that migraine is a vasodilating event, and this drug is a vasoconstrictor, and that's how it works. What about controlled drug studies for Trudeasia? There was a phase 3 open-label pivotal safety study called the STOP 301, and that was the largest longitudinal study ever conducted for nasal DHE. They had 5,650 migraine attacks. Wow. The objective of the study was to assess the safety, tolerability, and effectiveness of Trudeasia, and the drug was well tolerated and provided rapid, sustained, and consistent relief of migraine headache symptoms. Unlike oral triptan treatment, which needs to be given within 1 hour of onset of attack, Trudeasia was effective even late into the migraine attack. My migraine patients are always late in taking their meds. It seems I preach to them always treat at onset. So this would be a good drug for taking later in an attack. It seems to work there, whereas triptans sort of don't that well. What was the reported effectiveness of Trudeasia? In this study, more than a third of patients had pain freedom, 2/3 had pain relief, and more than half had freedom from their most bothersome migraine symptom at 2 hours after their first dose. The great majority of patients, which was 84%, reported that Trudeasia was easy to use and they preferred it over their current therapy. Well, what have headache specialists said about Trudeasia? Stephanie Nahas-Geiger, Associate Professor, Department of Neurology and Program Director of the Headache Medicine Fellowship Program at Thomas Jefferson University, stated, and I quote, "Many of my patients need more from their migraine treatment, and Trudeasia offers a non-oral, fast-acting, reliable option that overcomes many current medication challenges. Its upper nasal delivery circumvents the GI tract and common phenomena associated with migraine, such as nausea and gastroparesis, which can impact the effectiveness of oral treatments. And importantly, it's a self-administered single dose that can be taken anytime during a migraine attack, so patients do not need to worry about missing an opportunity to benefit from using it within a certain time frame. I think patients will be very receptive to this treatment because it pairs the long proven results of using DHE with a patient-friendly delivery system. On my blog, I have a group of articles that have been written showing the use of DHE for treating migraine. I thank you very much for listening. Please click on subscribe. That's all for it today, and I'll see you again on the next podcast.